Welcome to Music and Medicine on Monday, a collaboration between the College of Medicine and the School of Music here at the University of Iowa. This podcast is designed to help musicians play and to stay healthy. Today's session focuses on adaptations women working as musicians make in the short term after delivery. This video is supplemented with more written material available on the Iowa Protocols, a free medical website that can be accessed by the QR code or the website address below. We're coming to you from the recital hall in the beautiful Voxman building in the School of Music here at the University of Iowa. My name is Harry Hoffman. I'm a physician at the University of Iowa, and I'm pleased to introduce our featured performers. Our musical expert and also performer is Katie Ambrose. She's an assistant professor of horn, the French horn, in the University of Iowa School of Music. With us also is Abby Chen, a graduate student in organ performance to receive her DMA in December. We also have Michelle Monroe to finish coursework in December for a DMA in vocal performance, voice performance. She's on the faculty at UNI as an associate adjunct professor of voice. We also have Sarah Hackman, a second-year student getting her DMA in voice. And our medical expert today is Dr. Mark Centillion, professor of obstetrics and gynecology, clinically active high-risk obstetrician scientist at the University of Iowa, who plays guitar and bass in two bands, the Grain Belt Groove and the Reese Submissions, and also plays in orchestra pits around for community musicals. With that, perhaps we could get some information initially from Michelle.
Yeah,
Maybe you can
sure.
tell us a little bit about your background and how you got interested in music and the musical piece you're going to perform.
I grew up in music and arts of all kind. We were in dance and piano and singing in church. I did children's choir, and then going on, I was actually a very active horn player and went to college for horn. And then it became clear I needed to either transfer or change. So I became a singer because I loved my voice teacher, and that's turned out well. I chose the piece I'm going to sing today. It's called Domesticity. It's from a song cycle called Casa Guidi by Dominic Argento. He was an award-winning composer based in Minnesota. And this set of songs is based on letters from Elizabeth Barrett Browning, the famous poet, that she wrote to her sister. And she, in these series of 5 songs, we get a little taste into her journey, into her marriage, her forbidden marriage with Robert Browning. And this domesticity ends the cycle, and it's just this beautiful, blissful picture of their home life on an evening in November, where she's sitting by the fireplace with her husband, and her little one comes in, and only Mama knows what her little boy needs. So I just felt very connected to this piece, and appropriately I learned it after I had my baby, and so I hadn't been able to get through a performance of it without getting a little teary because of their special bond.
Terrific, great. And my understanding is that Maria Ahajanovan is going to be accompanying
Maria
you.
Ahajanovan will be collaborating with me today, and we've performed these together before.
And Katie, how about your background and the song you're going to perform?
Sure. I started playing horn when I was 10 in 5th grade, but before that I had been a Suzuki kid. I started playing violin when I was approximately age 3, and we moved, so I played violin for a year and a half or so, and then we moved to a town that didn't have a Suzuki program anymore. No Prusel school, unfortunately. And my parents they are now retired. They're music teachers, music educators. My grandfather was chief of surgery at Detroit Receiving, and he would sing opera in the operating room. So music was it was always there. I grew up with music all around me and all around my family, and it was never something that I considered stopping doing at any point. So I did my undergraduate degree in horn and my graduate degrees all in horn, and now here I am in Iowa. The piece that I'm going to be performing today, I'll read some notes about it when I get up to play, but it's called Laho. It's named after a river. and it was written for me. I commissioned a young woman to write this when I was pregnant, and I knew I was going to have to be giving a faculty recital in the spring. I was having my boys in December. So I was trying to plan my repertoire based on what I knew I was going to be able to do in March after having given birth in December. So Rachel was amazing, and we worked together to build this piece, which is highly improvisatory. The actual manuscript is shape form, and it's based in breath, and it has a background of pink noise, which is said to be great for soothing babies. And it's a piece I'm excited to play for you all.
Terrific. Wow, that was fantastic. Now we're going to embark on a discussion of the postpartum period. I think they call it the fourth trimester. Is that right, Mark?
Yeah, that's right.
Lead the discussion about what to expect and how to deal with it.
What to expect after you expect it and already had it.
Right.
Right? But this focus on what happens after you have a baby, and the health changes and the changes in your body is significant. It's almost just as important as what was going on with you during your pregnancy. Now you start becoming outside of the purview of your obsessive obstetrician, and now we need to make sure we do the appropriate health handoff and talk about those things that could follow you outside, and changes to your body and life in general after you have that baby. One of the things that we were talking about before in the previous session was kind of pelvic floor changes, which is legit and real. Don't know if you guys want to maybe recant a story or two.
Especially with respect to your musician.
Sure.
Yeah.
I'm happy to dig in.
Yeah,
I feel
okay.
very passionately about this because it took me by surprise.
Surprise.
And really made me change the way, kind of retool my support as a singer. And I was dealing with it for months and months. So I had a precipitous labor, and my sweet little boy wanted to come out sunny side up. And I had second-degree tearing. And so I had some stitching, and about maybe 8 weeks postpartum, I'm still having a lot of just I felt a lot of trouble even just like walking around my house. Like I felt like everything was falling out of me. And I had a wonderful friend who said, go to this PT, they're great. And they did some important work on helping with the scar tissue heal well and helping me get some flexibility, because I realized that I really kind of bared down my pelvic floor and it was just all the time. So they helped me find a balance of flexibility and strength. And my first performance postpartum was about 4 months after baby was born. And I really had to focus to keep that from being painful.
Sure.
I had to think about how I was adjusting my support, and even through my rehearsal up for that, it was a very different rehearsal process because I was relearning my body.
Right.
I felt like.
And you said PT. I mean,
Physical therapy.
Is it more than just physical therapists?
A pelvic floor specialist.
And there's not too many of them around?
There are not. This is a very special crew of physical therapists where they use different kinds of tools to strengthen those muscles. Mainly not only to make sure that you have the strength to do what you do. If you're going to bear down and hit that C7, right? If you really need to really deep down there to get it, without causing significant pain on the repair that was there, or cause some incontinence, right? So this is a real thing that that women experience during pregnancy, having stress incontinence. People don't want to talk about it because it's embarrassing, but it's part of the normal physiology of pregnancy, unfortunately. So I'm here to normalize that. It's okay, and you should wear it as a badge of honor because you are now a mom. But part of that, it does make it difficult, as you're even in this postpartum period, as you're hitting a super duper high node, you have to think about how do you protect yourself from doing that. And physical therapy is a wonderful way to do it. The second degree tear that you had is actually fairly common. And almost everyone has one of those, particularly with their first pregnancies. But there can be worse degree tears that can cause more damage. And cause more things like fecal incontinence and urinary incontinence, and cause significant pain. And in those cases, something struck me when you said, when I felt like everything was coming out. You're like, put it back in. We have the put it back in doctors, okay? Those are our urogynecologists. They are folks that specifically are, they're people who did an OBGYN residency and did a fellowship, to 3-year fellowship to specifically learn how to take care of, they're almost like hernias down there in a sense, because things feel like they're falling out. Well, we're gonna kind of put them back up there, including your bowels, including your bladder, so that you are not having pain or incontinence. So there are venues for that. So a lot of times the patient population for that tends to be a little bit older, and because they've already lived their life and have had spent their entire life putting pressure on their pelvic floor, and now that's when the symptoms are there. But if you have them sooner, I would encourage people to go reach out to your neighborhood friendly OBGYN to see if they have a urogynecologist friend that they could refer you to.
Is there a urology as well?
It's urogynecology is female pelvic medicine and reconstructive surgery. That's the official term now. It's really long. That's why I just called it urogynecology. But those folks are OBGYN trained by 4-year residency, then a 3-year fellowship in urogyn. There are some urologists that are trained in urogynecology, but they tend to do more of the kidney-related stuff. They do a lot of the similar surgeries. And if you are later in life and you do feel like things are falling out, and it has, if people want to Google uterine procedentia, feel free to do that. I'll leave that up to you. But that is kind of when the uterus is coming out. There are surgical options for that in order to kind of put things back up and kind of restore a woman's ability to function in life without having to feel like everything's coming out.
And particularly a problem for musicians, I suspect.
Yeah.
A lot of what you do increases your intra-abdominal pressure as you're expanding your lungs and playing the French horn or singing.
Yeah, this is something that I don't think we speak about it enough.
Right.
In terms of when we are thinking of pedagogy, when we're thinking of support, regardless of pregnancy or not. Oh gosh, this is TMI, but we're just gonna go there because we're talking about.
It's not too much information.
It's not too much.
We can talk about it.
It's all information.
But I have a couple stories that, oh my gosh, my mother would be mortified to hear, but
Mom, don't watch.
that's right, or not. But
Right.
I remember in maybe grade 6 or grade 7, and I, had just gotten my period. I'd gotten it that year, and I was wearing white pants because I didn't know.
Right.
And I'm in a horn lesson, and my teacher's telling me, trying to play louder, or trying to play higher or something, and she just, oh, okay, good job. And I was so fortunate to have a woman for my first horn teacher, and then leaving, and then she's saying, Katie she's blood on her pants, and when my mom was saying, hey, let's not wear white pants when we have our periods anymore. And, but that was the pressure.
Yep.
And then playing, I was probably in my late 20s, a Stan Kenton concert. Stan Kenton was a composer for big bands, and so these crazy screaming high charts, really, really high playing, really loud. And then I had my annual the next day, and my doctor was like, what is happening? Why can you just relax? And I was like, I'm not relaxed, but everything was so tight. He couldn't get the speculum in. It was just, and then just like, still to this day, if I am having, because I'm in perimenopause now, so some months are very light and some months are not. And if I have a very heavy day and I am really, really going for a high note or a loud note, and hello, there she is, Aunt Flo, she's there. And this is stuff that we all, as women brass players, we talk about in these, little whispered conversations, or we send each other funny texts like, oh, I did this last month. Like, I just went for a high B and now I have to go home and change my pants. And this is all related, and it's, we can laugh about it because we're educated, but when you're in grade 5 or 6, this is terrifying, and this is something that might keep you from continuing on the instrument. And it's all related to what we're talking about with incontinence, which there's so much feeling of shame about it too. And so I love just that we're having this conversation because we're normalizing it. And this is what, we were sort of talking about things we didn't expect. I think we need to help women to expect these things because it takes the shame out of it. And it's truly, there's nothing more natural.
Right.
There's nothing more normal. But we're trying to continue and have our careers and do all of these things in a system that's not really designed for that 4th trimester specifically, but also for a lot of things about women's reproductive health.
And I appreciate you giving those resources, because I think a lot of times historically women will say, well, that just happens, and then you just have to live with it, and now you can't do all these things you used to love because you're going to pee your pants. And just knowing that there are things you can do about it, and that we can talk
So
about
Mark,
it.
you have some website resources that maybe we can provide both with our video and also on the Iowa protocols.
We could do that. Anything from the American College of Obstetrics and Gynecology, and you look up urogynecology, there's a ton of resources there to talk about it. You brought up perimenopausal. In truth, this is sort of the time, perimenopause is sort of the time where the discussion of urogynecology comes up, right? Like, I'm done having my kids, And if this is causing us fecal incontinence or urinary incontinence, or the fact that you feel like everything's coming out is really affecting your work, your life, everything. And that is the essential question that we'll ask you, because a little bit of this is it affecting your life so much that you can't function normally? And it can be a huge detriment to your life, that it is okay to go seek help for that, and you should. And this is kind of the time when people actually start going, all right, I'm done having my kids. Maybe it's time to think about treatment.
And how successful is the surgery for?
The surgeries are pretty successful, as long as they keep, the physical therapy. It's like everything comes with physical. It's almost like, you think about it like orthopedics. You can't break a bone and not have physical therapy every day. You can't break your pelvic areas without having, you can't break your pelvic muscles without also having physical therapy. So.
And Sarah and I were talking about Pilates.
Yeah.
Pilates has been, for me, and I don't want to speak for you, but
Yeah.
an absolute godsend.
Yeah, I think especially this is also very personal, but yeah, I did the physical therapist for my pelvic floor, and that was helpful. But I don't think it was as helpful as just I happened to start doing Pilates like a year ago, and suddenly I had a significant decrease in incontinence.
Does that address that particularly? The Pilates? I know there's all sorts of mat and machine and wall
Right, and there are
Pilates.
some. I was just doing it at home with a video for free on YouTube.
Specifically
so
targeted.
really, we're talking really basic.
And it was targeted Pilates, not just general.
It was just general Pilates, but because I think all Pilates tends to use a lot of different muscles in the pelvic floor and in the lots of different groups of abdominal muscles,
Right.
I think it just really has helped me a lot personally. Just overall, it's been a big help.
And it's based on stabilizing the core, and the core is that's the home for the entire chain, the chains that go down and the chains that go up. And for me, Pilates makes me focus on these muscles that I didn't. When you're young, you don't think about your muscles because they're all, you can use them all so easily.
Right.
And when I was immediately postpartum, I was doing, it was called red cord therapy, which is, it's PT, but it's similar to like a Pilates reformer.
Okay.
And so they stabilize different parts of your body so that you can focus on the tiniest little muscles that you can. So it was like, stabilizing your right leg so that you can focus on your left toe. Not really, but it's so these sort of things where I was realizing that I couldn't feel these muscles in my trunk, that it wasn't even that I couldn't get them to turn on. I didn't have that sensation anymore. And my C-section didn't go wrong. It healed beautifully and everything was fine, but it was just that whatever had turned off during pregnancy, during postpartum, I had to work very hard to get those sensations to turn back on.
I think you bring up a good point. I think the incontinence issues and the pelvic floor things often get relegated to people. They're like, oh, I had a C-section, I'll be fine. And we had this discussion earlier. I'm like, does a C-section save you from all of that? The answer is no. You still carried a human being for almost 40 weeks. Your life is forever remodeled. Not only for just having this kiddo, but your body is. And so I think it's important to remember that. And so, the Pilates I would see is an extension of the physical therapy, and it's a little bit of learning how to activate those nerves and those muscles that you just didn't know you just took it, you just used and didn't think about it until they didn't work so well anymore.
Well, the thing with the C-section is you've not only carried a baby, but now you've also endured major abdominal surgery that you have to heal yourself from that surgery, as well as you're being thrown into the pit of taking care of a human.
Or two.
Or two.
In your case.
Yeah, that's right.
Or 3 or 4, right? If you already have other children, those caretaking the duties don't go away.
Well, that's a wonderful transition to the mental health issue.
Yeah.
The postpartum depression. Mark, do you want to take off on that?
Oh, sure. Certainly we used the term stress test before. Pregnancy is certainly a stress test for women, and regardless of what your age is. Certainly mental health should be, and again, this is my soapbox, should be in the same platform as all of the physical health we talk about. It's just as important as the blood pressures that we follow. It's just as important as the blood sugars we follow. If not even more important, because it kind of helps being able to control those other things. And so we know that the postpartum blues is a real thing. It's not a full depressive diagnosis, but almost everybody gets postpartum blues. It's when we start crossing over to affecting your work life and your daily life with your family and your friends and all of that, does that start becoming more pathologic? And into areas where we need to address it, whether that's medications or therapy. And I think at the University of Iowa, there are some particular patients where we will have them come back a little bit sooner, even though they were perfectly healthy, but they might have had a particular event, or we know that they have a history of ongoing depression. We'll have them come back just so we call a mood check. I'm like, how you doing? Let me talk with you. And then we screen them to make sure that there isn't any overt signs of depression or anxiety. Postpartum, if you're going to have it, if you don't have any history of any mood disorder, if you're going to have it, it's usually during the postpartum period. And so again, something that affects you for the rest of your life, if not treated.
There are, what are the happy hormones that you get from nursing? Is it oxytocin?
Yeah. It's certainly oxytocin physiologically is important for bonding. We know that that's the case. It's the happy hormone that goes, yep, that's my kid. I'm going to continue to feed this kiddo. It's not that strong that it can't be overcome by depression and anxiety. So there is a bit of, it's funny, a lot of times we will, when you do have that second degree tear, which obstetricians, we call it baby anesthesia. We could be repairing down below. They won't know what's going on. Even without an epidural, I'm like, here's baby. And they're like, baby's cooing. And I'm putting needles where I shouldn't be putting needles. I'm putting stitches to fix things. And they're like, are you okay? Yeah, I'm fine. I'm like, okay, fantastic. Baby anesthesia. We will give them local anesthetics if they need it, if they don't have an epidural or something else. But a lot of times we'll ask them, like, are you doing okay? Do you want me to poke you down here with another medication? They're like, no, I'm fine. Keep going. I'm like, okay. Right, whatever you do. So while baby anesthesia and the oxytocin is an important thing, being treated and recognizing it early. And again, this is another, my soapbox to have folks advocate for themselves or have their family do it, because it may be hard to see in yourself. And so a lot of times we'll talk with family members. It's like, this pregnancy is not just happening to you, it's happening to this clan of people. We'll help talk to your clan and say, hey, things don't seem right. Please reach out to us, and we'll we'll make sure we get you to the right resources, whether it's therapists or medications. But
that can also, that oxytocin, you're the expert, I might be totally wrong on this, but it can mask pain too, right?
Well, as I was talking about baby anesthesia, it's more the fact that it helps in the bonding and rather than masking pain.
Yeah. Because I read somewhere about there are more. I had the worst sprained ankle of my entire life. Running in my fourth trim, going for a jog and hitting the curb wrong, and I was just like, oh, whatever. Not a big deal. And then the doctor was like, you should not be on your feet at all. I can't believe you continued jogging. So I was just like, oh, it must be my crazy, amazing hormones that are keeping me from feeling pain.
Or you're a healthy woman, and that's okay, and that's okay.
Yeah, but it was the joints, the same thing as
Well, that takes time. So the postpartum period, we say is about 6 weeks. In truth, from a physiologic basis, if you read the books, it's actually 12 weeks. It's a little bit longer than that. Immediately, so you may have realized this. I mean, when you have babies, your heart rate goes up to like up here. You may be like a marathon runner with a heart rate in the 50s and the 60s, but as soon as you get pregnant, that thing starts going up and up and up and up, and it's normal to have a heart rate in the 110s, 120s, because you have all this extra fluid on board, and your heart is working harder, and you feel it. That time to once you've got to this peak of cardiovascular stress at the time of delivery takes time to go down. You know, even though your cardiac output and the strength of your heartbeats and that goes down, the fluid takes a long time. How long did you feel swollen after you delivered?
My wedding ring still didn't fit.
Right? You're like,
We got a different one.
oh, yeah, you're like, never mind. Right?
Still swollen.
Right.
Now I'm pregnant again.
We're just gonna keep. Why don't we just tattoo one on instead? So yeah, I mean, right? So that's the thing. You're persistently. It takes a lot of time to get back to normal. From a cardiovascular standpoint, things flip over usually by 6 to 8 weeks, but it takes time.
When did the joints go back? Because we were talking about the tenosynovitis,
Yeah.
and yeah, because I had that from the tandem nursing.
Yeah.
And just holding them, and just the weight of the boys, and then the weight of the horn, and I had to have cortisone shots in both of my thumbs, and that was a long time.
Yeah, and it could be because you had 3 babies. You had your horn and your twins at the same time,
Yeah.
and it's right. I mean, it's kind of, you think about it as sort of a repetitive use injury, sort of, right? And so, like I said, the fluid changes goes away fairly quickly, which drives a lot of the kind of joint-y things that people have. But still, that's why we say, we'll see you back in 6 weeks. This is when you should start feeling like you're going to be 100%. And it can take time. Some people are great. They're like, Mark, I used to tell people way back in the day not to drive this was way back in the day, for like 6 weeks, especially with C-sections. And I had a lot of women say, no, I have things to do. And I'm like, oh, I understand. And, a little bit of this is protecting this incision, but it's to make sure that they're feeling up to it, right? And everyone's pregnancy experience is completely different. I've had women who have had C-sections, and like 24 hours out, can I go home now, Mark? I'm like, I'm feeling fine. I see them the next week. Yeah, I'm fine. I'm good. All right. And then I have people who have a normal, beautiful vaginal delivery that are having a really hard time, right? And in terms of recovery. So a little bit of this is driven by your very particular experience. But
Did you guys have to wear the corsets afterward? Me too. Yeah, you didn't have to. Yeah.
After the C-section.
Mm-hmm. Did you have a C-section?
No, I didn't.
Yeah.
I was recommended.
Yeah. How long did you wear yours?
Well, probably a month.
I think I was like 5 or 6 weeks.
like the abdominal binder that.
Yeah.
Yeah. Exactly. It has
It looks like a big stretchy tortilla that Velcros on top. Yeah.
Yeah.
We use that a lot to help strengthen your core, because especially if you have a C-section, the last thing we want you to do is just to be putting all your pressure on that fresh new incision that we just fixed up. And so that is at least to help. And a little bit of that, some people hate it and don't use it at all, but if it helps.
It's the most uncomfortable thing.
Yeah.
It's terrible.
Yeah.
And then you're trying to play and you're trying to take it, and it's just, it's the
Constricting.
worst.
Yeah,
And
I would think playing with that would be difficult.
yeah, I'm convinced that's why the diastasis recti is as bad as it got as bad as it did, because I took it off. I didn't. It was,
Maybe we should conclude with the diastasis recti. What is a diastasis recti?
Oh, sure. So we all have 6 packs right here, the abdominal muscles, and it's when it separates. And instead of having a 6-pack, you can have 2-3 packs, right? And so that can cause like some herniation of the tissue underneath the muscles, and it can cause significant pain. But then you also don't have the strength of your core, because now instead of your core being up here, It's off to the sides.
Is it similar to a hernia?
Yeah, it's kind of like a hernia.
And
yeah.
are there surgical repairs? Is that what you?
You know, most of the time you don't need to necessarily repair them. It's
Just
not
wear a
like where
corset.
you have bowels coming
Yeah.
coming out, right? And a little bit of this is, you know, we talk about PT and talk, especially if it's causing pain, but you know, doing crunches, you know, to help strengthen those muscles so they start coming together is one simple way of doing it. But physical therapy is one thing.
Yeah, and the physical therapy, did you guys have to do that?
I did a little bit.
Because it's actually, they don't want you to do crunches, they want you to do everything with tabletop. And
Right.
So, yeah, which is like so fascinating because it's totally anti, you know, what we've been taught before, which is you strengthen your core by doing crunches, but actually that just makes everything come out through the,
Right.
Yeah.
Yeah.
Need some guidance with it.
Yeah, definitely, and that's Pilates is super helpful. And then, but if you don't, then your back, you can have all these
Yeah,
back
I should
issues.
try that.
Yeah.
This has been great. Mark, Sarah, Michelle, Abby, Katie, thank you very much for your performance and your discussion. Additional detail regarding this and other sessions for Music and Medicine on Monday can be accessed by the QR code displayed or our website address, searching on the web for Iowa Protocols, Music and Medicine on Monday.
Upon which he walks straight up to me and puts up one foot, pointing to it with his hand. He walks straight up to me and puts up his foot, pulling at my gown. Perhaps you don't know what this means, but I do. But I do. He wants to go